I've been thinking about healthcare systems lately
Oh,
and how different countries approach them.
yeah, it's really interesting. Some have public systems, others are private. What's your take on that?
Well, public healthcare systems are government funded and provide universal access to everyone. They're
Right.
funded through taxes or mandatory contributions.
So basically, everyone gets care no matter their income?
Exactly. Countries like the UK with its NHS, Canada, and
Mm.
Sweden have such systems.
But doesn't that mean higher taxes and potentially longer wait times?
Yes, that's part of the trade off. You might have to wait longer for non urgent treatments, and taxes are
Yeah.
higher. It's like standing in line at a popular coffee shop. You get good coffee, but you have to wait.
Haha, I can relate to that. But at least everyone gets coffee, right? I mean, care.
Exactly. And with universal access, there's better preventive care, which can lower long term
Right.
costs. Fewer untreated conditions mean healthier populations overall.
But what about innovation? I've heard that public systems can be bureaucratic and slow down advancements.
That's a valid point. Bureaucracy can sometimes stifle innovation. It's a
Yeah.
bit of a double edged sword.
So, how do private healthcare systems differ?
Well, private systems are mainly funded by private insurance, employers, or
Okay.
individuals. There's more competition, which can lead to faster access to specialists and treatments.
But that competition can drive costs up, right?
Exactly. It can get really expensive with high insurance premiums and medical bills.
Yeah.
So, not everyone can afford it, and millions may lack access to affordable care.
So, it's like having a fast lane on the highway, but only
Right.
people who can pay the toll can use it.
Yes, precisely. And while the private system encourages innovation, it can be profit driven. That sometimes leads to higher costs and less focus on patient outcomes.
It's a tricky balance. Are hybrid systems the answer?
Many think so. Hybrid systems aim to combine the best of both
Yeah.
worlds. Countries like Germany and Australia have public healthcare with options to go private for extra benefits.
So, everyone has access, but you can opt for more if you want?
Exactly. It's like a base model car that gets you from A to B,
Haha.
but you can add on leather seats and a sunroof if you like.
Nice analogy, but do those systems work efficiently?
Well, they can, but it's not always smooth
Yeah.
sailing. The public and private sectors need to work together efficiently, and that's not always easy.
Gotcha. Speaking of unique systems, the US comes to mind.
Oh, yes. The US is a unique case. It's the most expensive healthcare system globally, but doesn't guarantee universal coverage.
Right. They have both public and private elements, don't they?
Yeah, they have programs like Medicare and Medicaid, but most people rely on private insurance through employers or the
Okay.
marketplace.
Yet many are still uninsured?
Exactly. High costs and lack of universal coverage are big issues. Medical
Yeah.
debt is a leading cause of bankruptcy there.
That's alarming. What's the political debate like over there?
It's pretty polarized. On one side, people advocate for universal healthcare, believing it's a human right. On the other side, there's a push for free market solutions.
Is there any middle ground?
Some suggest a public option where government insurance is available but private insurance still exists. It's about expanding coverage while preserving choice.
Do you think that's feasible?
It's challenging. There are powerful stakeholders like insurance companies and pharmaceutical industries that resist major changes.
Yeah. So, what can be done to improve healthcare systems overall?
Well, possible reforms include universal basic coverage, price transparency, investing in preventive care, and lowering drug prices.
Right. But implementing those isn't easy, is it?
No, it's not. It's like trying to turn a cruise ship. It takes time and effort.
Yeah. Well, it's been enlightening discussing this. There's a lot to consider when it comes to healthcare systems.
Absolutely. It's a complex issue, but understanding the pros and cons of different systems is a good place to start.